Well, I just wasn't hearing anything, so I just felt left out of any conversation. That stopped me from going out a lot, because what pleasure was I going to get out of it because I could not hear it? So, ending up staying at home. People don't know that you're deaf, and they but don't speak out loud. So you answer them and you hope it's the right answer. Well, half the time it's not. So isolation, it's terrible.
It's clear that some of the most unfortunate side effects of hearing loss include frustration and embarrassment, leading to social withdrawal, and thus to isolation. This can worsen depression and dementia, and sometimes be confused with severe dementia. Communication is a two-way responsibility. Simple techniques will greatly help hearing-impaired people to understand what you are saying, whether or not they're using hearing aids. First, get the listener's attention. Reduce or move away from background noise. Have light on your face, not shining in the listener's eyes. Keep your hands away from your face. Let the listener see what you are saying. Avoid waving your hands around. Do not distract the listener. If something you say is not understood, find another way of saying the same thing. This will give the listener a different and hopefully easier combination of sounds to hear. Be aware that a listener may have difficulty understanding speech, even with a hearing aid.
Before inserting an aid, wash your hands with water or alcohol wipes and ask permission of the resident. Report any signs of blood, discharge or broken skin to your supervisor. Aids should be turned off during insertion. Check the colour indicator to ensure that the aids are inserted in the correct ears, red for right and blue for left. To insert a behind-the-ear aid, insert the mould into the ear canal, gently but firmly twisting the mould towards the back of the head, making sure that the top of the mould goes under the lip of the ear to avoid discomfort for the wearer and possible skin irritation. If it whistles, try to settle the mould better into the ear. Sometimes lubricant is required to correctly position the mould. Contact your supervisor in this case. After an aid has been inserted and whistling stopped, take a step back and possibly turn aside from the resident, then ask a straightforward question in a normal voice to check that the aid is functioning satisfactorily. The battery compartment is at the bottom of a BTE aid. Remove the battery with the magnetic tip of the wax cleaning tool. Don't bang an aid to remove the battery. Dispose of the old batteries in the rubbish bin immediately to avoid possible confusion with a new battery. It's a very easy mistake to make. Different types of aids take different sized batteries, so be sure that you use the right size. Pick up a new battery with the magnetic tip of the wax cleaning tool, the plus sign on the battery facing up. Never force a battery into the compartment as this may damage the casing. Close the battery compartment carefully. Open the battery compartment of an ITE aid, then remove or insert the battery in the same way as for the BTE aids. When a new battery has been installed in either type of aid and the battery door has been shut, the aid is turned on. Cup the aid in your hand and hold it up to your ear where it should whistle, indicating that the battery is okay.